Ron G Morning Show, Monday through Friday from 7 a.m. to 10 a.m. only on WSAN Radio. All right. Good afternoon, everybody. Good afternoon once again. This is WSN Radio with Ron G in the afternoon show. So we have a treat for you today. I have two young ladies going to tell us about how to stay fit, how to be mindful what you do and what you say. I'm going to use the word be gentle because a lot of people just brash. You know, they come out and say something. When they say it, I didn't mean to say it like that. Yes, you did. You wouldn't have said it, you know. So how can I start this? I'll start off with you, Coach K.
All right, guys. I am Coach K, owner of Wanna Go Fit. I wanted to invite you to meet this awesome woman here, Dr. Musa. She is the owner of Kingdom Healing Institute, and they are doing some amazing things there. I, as you know, am saving the world 1 pound at a time, doing my part. And, I say it is not always about weight. I mean that. This is from a mind, body, spirit type of approach. So with my approach being one of a holistic approach, why not team up with somebody else who has the same idea? So I'm going to let Dr. Musa introduce herself and tell you what they have going on over there. Because I'm telling you, I have some questions that, I'm pretty sure other people are like, what's that? But you start.
Yeah, so I'm Dr. Adetoun Musa. I'm a double board certified neurologist and epilepsy specialist and the CEO of the Kingdom Healing Institute. And our specialty is not just neurology, it's pain medicine as well. And we approach our patient treatment plans holistically. Just like Wanna Go Fit, we look at the whole patient. So this is mind, soul, body, spirit. It may have to do with psychological issues that the patient is struggling with. It may not just be the physical problem. And some of these physical problems include seizures, epilepsy, migraine, concussion, traumatic brain injury, memory problems, dementia, chronic pain, low back pain. All of these things can be targeted in a way that integrates all of that person's life and life choices. And we coach people in making good choices in diet and exercise, and we integrate pharmaceuticals that could be medications, it can be supplements, and some alternative therapies that are research-backed.
Nice. Personally, when you started off, that was my first question. Ma'am, what is double board certified? What does that mean?
Yeah, well, it means that I have a specialty training in neurology with additional subspecialty focus. So that subspecialty focus is in epilepsy. It's a subset of neurological sciences. And with neurology, we really focus on the entire nervous system. That could be the brain, it can be the nerves, it can be the spinal cord. For epilepsy, we focus on people who come in with seizures, and seizures are abnormal electrical activity in the brain that can cause people to have what we used to call grand mal seizures, these big shaking fits. And it can cause even smaller changes in their behavior that you may not even be aware are seizures. And that's when you need to seek a medical professional for diagnosis and treatment.
Now, if someone isn't having one of these grand seizures, as you mentioned, and it's something smaller, what does that look like? Because of course, we know what a grand seizure looks like. So what would something smaller look like?
So a smaller seizure could look like anything. It can look like a stereotyped or repetitive behavior. This can be maybe a 10-year-old girl who's in class who stares off into space. And she does that 10 times a day. The teacher thinks, well, maybe she's just daydreaming and she's not paying attention, or maybe she has ADD. That could be a seizure. Sometimes we call those absence seizures or absent seizures. Another type of seizure that's small that you may not identify readily is maybe small movements in the face, the arm, or the leg, like twitching episodes.
Mhm.
Really, any behavior that keeps recurring the same way every time, it could be an electrical problem in the brain, like a seizure.
Wow.
Yeah,
Wow.
I
I,
didn't
I
know
mean,
that.
now,
absolutely. A lot of people don't know. Yeah.
because in my mind, I'm thinking to myself, I'm going through my behavior like, do you do any of that? Are you sure? You know, because I definitely stare off a lot. But I do think that, like you said, just being aware of certain things, maybe one thing that I notice here now, parents are more aware of things that have, conditions and disabilities now. So
Mhm.
because we have so many tools
Mhm.
available to us, I just think that knowledge is power, and not just as parents, health in general as a whole. One of the things that I found very interesting about your background was you were part of the study using AI
Mhm.
to it was for I believe for what was that
Yeah,
dementia.
dementia.
So to decipher dementia patterns. Now Ron and I had a conversation about AI a couple of weeks ago, and
Right.
we were just saying how we need to get with it. But
Yeah.
tell me how you were able to implement this tool to figure out, or like you said, to use it to be able to be beneficial for
Yeah,
dementia patients.
absolutely. Dementia is a growing problem in this country, actually worldwide. And artificial intelligence and machine learning, it helps to identify patterns in just regular diagnostic procedures. These are scans like MRI, for instance. I use EEG not just for the seizures that we mentioned earlier, but also sometimes for dementia symptoms in patients. And if you integrate AI into these imaging scans, it can pick out very subtle changes and patterns that you would see in a dementia patient. And the whole point of this is to identify these patterns early before someone is manifesting memory problems. So you can target that intervention early in that patient and slow down the progression of disease. That's the whole point of the AI.
Now, what are some of these earlier symptoms that would even land them in your office to say, maybe I should be checked or scanned or
Yeah.
monitored?
Absolutely. And again, I love what you said. Knowledge is power. This is not to instill any fear or, oh no, what's happening to me. It's just to attack it and take authority over it. So there are some signs. Some of the signs would be just, age-related changes like forgetting where you put your keys. A lot of people have that problem. More significant signs would be getting lost. When you're on your way to the grocery store, you've been there like several times, 100 times, and suddenly you don't remember. Other signs would be having trouble with language or communication. Now that this is not just forgetting somebody's name, but it's more significant, really forgetting chunks of your vocabulary. Other signs may be emotional. Some people cry easier. They may have negative or even positive emotions like feeling like they have to laugh, but this is something that's not as controlled as it
Mhm.
was in the past. So we call that a pseudobulbar affect, laughing and crying uncontrollably. These are sometimes signs of a dementia or what we call a neurodegenerative disorder. If any signs of memory impairment is something that's bothering you, or it's affecting your interpersonal relationships, it's affecting your job, that's a good reason to go seek help and go to a doctor like a neurologist.
Right. Right. That kind of sounds like right. It's not rocket
Yeah.
science, But
Yeah.
like you said, this morning a client and I, we were talking about just getting older. She has a birthday coming up. And she mentioned not being able to move the way that, she used to, and accepting it. And I mentioned to her, I said, I noticed that in the last year, I moved different. I moved different. And I told her, I said, at first, I was like, kind of fighting it, still trying to, do what I do. And I told her, I said, now I realize that I just need to learn how to adapt to how I move now and make it, the best movement that I could possibly make it. And I say that to say it's just part of age. So for someone who is, getting older, we're used to saying, oh man, I got misplaced my keys or so forth. Like you said, these things that are normal, as you get older. However, I do know that sometimes we're in denial about how severe these, things are happening or are they occur.
Yeah.
So I think that, like you said, just having some little cues, that's awesome. And you guys have a podcast where you educate people on certain matters. Am I correct?
Yeah, we did. We had a podcast. It's Healing Talks with Kingdom Docs. And we share just our knowledge on how to take care of your body, preventative medicine. We weave in some positivity, and we're believers. We weave in some scripture into that as well. And it's just a great uplifting podcast. It's on YouTube. You can look up Kingdom Docs and listen. I'll say that with age-related changes to your body, like you're not moving as fast, maybe you're misplacing keys, all these things, there are screening tools that you can use to just determine, well, is this normal or is this abnormal, right? That's the whole point. And then if there are some signs of abnormality, in our clinic, we have a way to mitigate or reduce the risk. And a lot of that is with, again, holistic therapy. So that means diet, exercise, checking your cholesterol, checking your blood pressure, making sure your blood pressure is well controlled, making sure that you have been checked for diabetes with an A1C. We do all of these things because in the research that I've seen, it's not just the scans that are having those telltale signs of dementia, but these different markers in your blood. So it's important to control these markers because things like high blood pressure and diabetes down the road, it does affect your brain and it can affect your memory as well. And then we also have brain training. And a lot of my patients over several years have asked, well, I'm not as sharp as I used to be. Is there something I can do to exercise my brain? And there is actually something called neurofeedback. And in addition to some of these screening tools, neurofeedback is another type of EEG device that you can put on, and it maps your brain. It looks at which areas of your brain are more active, less active, what are your strong points, what are your weak points, and then we're able to tailor a brain training program for you using this EEG technology.
Wow.
Yeah.
I heard of some things, but I'm being blown away right now. Number one is I do have type 2 diabetes.
Yeah.
And I have been taking care of myself. I brag to Coach K all the time. Oh, I'm down to 210 pounds.
Awesome.
And
Congratulations.
I was 232 in January.
Wow.
So I'm taking my time out with that. Now, my wife will say, I got dementia because I don't remember everything. Dude, I do remember things that's going on. And I play a lot of games.
Yeah.
And that keeps me sharp. My wife said, well, you doing something to keep my mind sharp. How you doing that? So I'm playing any games.
Yeah.
So I do things like that. But you said something about being type 2, high blood pressure.
Yeah.
Oh, I have all that. But it's in control now.
It's in control. And that's the most important part is just knowing and identifying, oh, okay, I have type 2 diabetes. I went to the doctor. They said XYZ. and just attacking that head on, and not avoiding any sort of diagnosis, just knowing, and then changing your diet. You know, maybe the right medications, medications can really help to put out the fire while you're recalibrating your diet and your exercise.
Wow.
Yeah.
So Coach K, I guess I've been doing okay, huh?
Yeah. Yeah, for sure.
You have been doing okay. Actually, what it sounds like you said, one thing that they do over there is they focus on, well, not necessarily focus on, but one of the focuses is that non-pharmaceutical wellness training, those type of programs.
Mhm.
That's what we need. I like that, here she is, look, I'm a double board certified, and she still comes back to diet and exercise. I mean, I'm not trying to, be the person, but come on. If everything keeps going back to diet and exercise, why is it that it is so hard to do? Like that's the thing. Is there a neurological thing behind that?
There is, it's a mental struggle. It's a motivational gap. And I think a lot of people are addicted to the wrong food. Sugar is a highly addictive substance. And this type of brain training and neurofeedback helps to overcome addiction. It helps your brain optimize or increase the good brain waves and frequencies. That's what we're measuring. And then it downplays the ones that are negative and counterproductive, like wanting that feedback loop every time I eat candy and ice cream and pizza and all these things. So it helps with that. And it helps with other things like attention. And these are all things that are important to achieve a goal. And there's something with our society now that it's just everything is microwaved, and you get what you want right away. There's no work involved. And so I think this neurofeedback, it's just a workout program. Just like you are training people, it's a training workout program for your brain so that you can achieve these goals.
One of the things I usually tell my clients, and I appreciate the ones that try and follow the plan that they're doing for that session, because they're doing what it is that I tell them that I'm doing. And it's just, I tell them, I said, we're just keeping them synapses popping, because and I tell them, by remembering your program, what comes next, how many, whatever, that is, like you said, cognitive training. You are, training, as you said, your brain. So that's why, like you said, I hate to be that person. However, exercise, definitely is more beneficial than just, to look good. Is definitely, on the side of the benefits of to exercise versus not.
Yeah. You need exercise. Exercise, like you said, it affects your whole body. It affects your mood. If people are struggling with low feelings or sadness or even depression, it really helps. It helps with chronic pain. It helps with migraine. It's a wonderful thing. And you're right. It's very simple. But I think there are a lot of people that struggle with it for sure.
So I got a question for you.
Mhm.
We go to the eye doctor, we go to a regular doctor, we go to the dentist, we do all that. Where do you come into play at when we need to come see you?
Great question. So there are two reasons you would come to see me. One is you've gone to your primary care doctor or your provider, and they've done like the basic checkup, but they find that there's something specific that's going wrong. Maybe your headaches are not going away. Maybe you're having behavioral arrests. There's, staring episodes, or you're falling for unknown reasons. You're having seizures. You're forgetting things. That's when the primary care doctor would refer to someone like me, like Kingdom Healing Institute and our neurology program. A lot of our patients also find us on Google because it's hard to find a neurologist within a timely manner. It's right now a 6-month wait, but it can be up to 13 months before you get in to see a neurologist for these problems. So we're actually able to see people within 1 week, sometimes the same day. We're able to enroll them in a brain training program, which is really preventative, within 1 week, sometimes the same day. And if you need any diagnostic tests, these are scans and EEGs because of these problems that are coming up, we could also do that within a week or the same day. This is much better than 13 months. And we're able to attack the problem quickly so that you're not experiencing worsening issues.
Okay.
Yeah.
And your clinic is a self-pay clinic, correct?
It is a self-pay clinic, and that's because we have found that within the insurance system, there are a lot of roadblocks to getting your care. Within the insurance system, typically the physician, the patient-doctor encounter is about 7 minutes. That's the national average. Imagine having a neurological problem, you have all these questions, and you're really only seeing the doctor for 7 minutes. There's really only enough time to write a prescription and send the patient on their way and say, come back in 6 months. But this, again, this is a comprehensive program. Since we're not tied to insurance, we don't need a referral. It's okay if your doctor sends a referral, but you can seek us out. And again, we can see you within that week. We can tailor a personalized plan just for you and what you're experiencing. If you are not into medications, that is okay. That we can tailor a treatment plan without the medications. And some of these treatment plans include frequency and energy modalities. Like, for instance, if you have pain, we have a electromagnetic device that helps with pain. We have access to alpha stimulation, which is electrical stimulation for headache and anxiety and insomnia. And then, like I said, the neurofeedback as well. We do incorporate dietary therapy. There's the ketogenic diet, modified Atkins diet, which we combine with medications for seizures and epilepsy management. So it's comprehensive. There are the pharmaceuticals, there are the supplements, there's the neurofeedback, and all of this combined helps our patients quickly. You don't wait.
Wow. And what is the bulk of your clientele? Like like you said, people find you on Google.
Mm-hmm.
What really makes someone, say, okay, well, this is it?
The bulk of our clientele is very diverse. It's all of San Antonio, but all of the surrounding areas. We have people coming from Corpus Christi, from the Valley, from other states because of the
Wow.
way to see a neurologist. People are seeking us out all hours of the day. In the middle of the night, I've seen appointment requests come in because they're frustrated with waiting and their problem is getting worse. We see people who come in or send those appointment requests after going to an emergency department because they fell and hit their head, and they have really horrible post-concussive syndrome, like, headache and dizziness, or someone who had a seizure and they've never had a seizure in their life, and they're waiting a year to see a neurologist, and in between they have seizures because nobody's addressing it. People who have memory problems, maybe progressive dementia symptoms, and their caretakers have really tried, but there's only so much they can do and they need help. So it's a wide array of people.
Wow. Wow. It definitely seems like you're busy and popping, which I know you guys just moved to a new location, right?
Yeah, we moved to a new location. It's still within the same building, but this new location is larger and we are able to accommodate patients even quicker. That was really the whole point, is to accommodate patients who are needing that brain scan technology, that EEG technology, so they can come in, get that EEG done, and that helps with diagnosis. It also helps with the treatment plan and so much more without having to wait and deteriorate while they're waiting.
Right.
Yeah.
Ooh, that word deteriorate.
Yeah.
Right? Oh, that's a strong, like, that made me say, oh man, let me make sure whatever I got going on, I get checked out. I don't want to deteriorate.
Yeah. Well, no, I mean, that's not our purpose. Really, what we want to do is empower patients, like you said, with knowledge. And once they understand what's going on with their body, we give them the tools on how to overcome that. And sometimes I see patients once or twice, sometimes it's months, or I have patients who've been with me since the inception of the clinic, and they're getting better. The ones that I really jump up and cheer for are the ones that graduate from our program. They don't need that intensive follow-up anymore. They don't need the medication titration. Everything is calibrated and regulated, and they're able to go out on their own and maybe just see me every once in a while. And I do see those people graduate, and that's my goal.
I like that.
Me too.
You know, Dr. Musa and Dr. Musa, both of them have sat on my panels that I've done in the past. This last one was our wellness fair that we did. And one of the things that you and your husband both, I like that you kept coming back to it and saying, be an advocate for your health.
Yeah.
And as you mentioned, because when you first said that 7 minutes, whichever one of y'all said it first, and I heard it, I was astounded. Because Ron, I'm gonna ask you, when you go to the doctors, how long do you wait?
Oh yeah.
Right?
Be honest with you, I got a pretty good doctor.
Well, that's awesome.
If my appointment is at 1:30, I'm being seen by 1:45.
That's really great.
But my point is, Ron, is the thing. If you're only allotted 7 minutes pretty much per patient.
Mm-hmm.
So that is you signing in, you going in, if you have to change clothes or whatever, but then someone coming in and you say, hey, this, that, whatever, and only being able to spend 7 minutes when, like you said, you may have tons of questions. I remember when they mentioned this, I was drawing off of my mom and her recent health issues, and she's still going through those same issues. She's still fighting to figure out what is her best course of action, can think these things that she needs, but in 7 minutes you're not going to get that. So I applaud y'all for being physicians and still saying, hey, be an advocate for yourself. Diet and exercise can help you in some of the issues that you may have, and just to keep you well calibrated. I like the calibrated, like you said, the graduation. So when someone graduates from that program, does that mean that maybe maybe they came in with pain or how is that it?
Absolutely. So pain is one. We've had people who've had really significant amounts of pain, and it's been resolved, and they don't need to see us every month or every few weeks anymore. And so what that looks like is they either go back to their primary care doctor for just their bulk of treatment, or they'll just come to us occasionally as needed. I've seen people with really uncontrolled seizures. They're having seizures 10 times a day, and those have drastically reduced. My goal is for you to have 0 seizures, and we've achieved that as well. And they don't need that intensive, coaching and medication adjustment anymore. And they go off and they see primarily their primary care doctor, and they come to me only for medication refills or whatever it is that's needed, only as needed. Migraines, we have really high success rate for all headache disorders. And that's because you need to pinpoint the type of headache a person has. If this is a recurring problem, there are many different headache diagnoses. So to get that accurate diagnosis, you get an accurate treatment plan, and they're off. They don't have a headache, they can go back to work. So we do get that graduation rate a lot.
I'm pretty sure it's someone that heard you say that and has been suffering with headaches for years, like Googling you right now. So
Yeah.
So if you can give us the address of where your clinic is listed, so that, and of course your telephone number and everything for them to be able to reach out to you.
Okay, yeah. So you can find us at www.thekingheals.com. So that's THEKINGHEALS.com. We're located in the Pyramid Plaza in the Medical Center on Suite 110, and we're called the Kingdom Healing Institute. You can reach us by phone, so that's 210-942-2055.
All right, so well, I really, like you said, I appreciate. I wanted to make sure that I didn't. Oh, I did. I want to come back to one question real quick. Let me make sure, Ron, that don't kill me. One question I did have when I was looking over some of the services that you mentioned, because like you said, you mentioned quite a bit, but it's a lot actually that you do treat. And one of them that I saw was numbness and weakness balance problems. And I work with a lot of older population, and I do a lot of balance training with them, core training, and I teach them, because we don't want you to fall, but you may, how to fall and so forth. So what if is what how do you treat people who have these issues?
There's so many reasons for balance problems, but the most common reason in San Antonio is probably diabetic polyneuropathy. So what that is you have diabetes and your blood sugars basically cause death of your nerve endings in your feet. And so your feet are numb, maybe they're tingly, and you just can't judge where your feet are in space. And that can cause falls and balance issues and walking problems. The way that we treat that, well, first of all, the primary way is to control your sugar levels. And so that's, diet, exercise, again, medications, working with your primary care doctor, losing weight. That stops the progression of the death of those nerve endings because of the blood sugar. And then the second way we treat that is pain control, because sometimes it's really painful and they just can't get around because it feels like they're walking on hot coals and pins and needles. So with diabetic polyneuropathy, there are many pain treatments that we offer. I work with a triple board certified pain doctor, which is my husband. So that's Dr. Musa. Dr. Hussein Musa. And one thing that we can incorporate is not just medications, but I had mentioned that electromagnetic device. That's the Provant device that helps to encourage healing and reduce inflammation, right, in those areas so that it's less painful. And then the other thing, sometimes spinal cord stimulation, which is an actual it's a minimally invasive surgical procedure, but that's another type of stimulation that helps with pain as well.
You hear that, Ron? She said here in San Antonio, the problem is diabetes. That's because it's a lot of tacos. You hear that? You hear that?
Yeah, you know what I told you? My doctor did not have to tell me to stop certain things.
Yeah.
I did it on my own.
That's awesome.
Because I knew I have a refrigerator in my refrigerator. I'm at my office. I always keep beer in there. Now, for the past 3 months, nothing but water's in there.
Yeah.
And so I won't be around to keep my grandkids around.
Yes.
I want to be here.
And you will.
And Coach KB, she be cracking on me sometimes, but she does it in a way that she knows that she's getting to me. And
it's motivation.
Yeah, and the problem is a lot of people that has diabetes, they don't have that willpower. They're almost like they just give up.
Yeah. So again, that willpower, it's a mental struggle. And one thing that we do a focus on is your thought life and really just taking authority over these problems. And some of these problems are health problems and they can be very overwhelming and scary, but it's not over. There's always hope. And you are strong enough to overcome these problems. And so we tell our patients that, and sometimes we'll incorporate technology into that, like the neurofeedback, We're combating fear and anxiety. These are all mental blocks, right? Depression, mental blocks to reach that success and that graduation rate.
So tell me about your marriage retreat that you have going on in San Antonio.
Yeah, so this is a workshop. It's a marriage workshop fundraiser, and all proceeds are going to go to our nonprofit medical ministry, the Kingdom Healthcare System. So in this marriage workshop, you're going to get the tools to identify challenges in your marriage. And we're also going to give you tools on how to overcome those challenges. These may be communication gaps or just feeling burnt out in your marriage. And we want to reignite that passion so that both husband and wife can identify what is their purpose and how do they achieve that purpose together.
Nice. Teamwork makes the dream work, right?
Absolutely. Yeah.
You know, and I do believe that most people don't understand that it is a partnership. You know, you are supposed to, go into it with knowing that that is your partner. So you need training for everything else. So why not? And when is that workshop again?
Well, you're going to receive all this information. November 9th is the workshop. It's from 10 a.m. to 2 p.m. There's going to be breakfast, lunch, speakers, really knowledgeable people. It's a great network opportunity as well. And again, that's November 9th from 10 a.m. to 2 p.m. Connected co-working space. That's the venue.
Nice. Awesome. Well, if you're in the area, I'm pretty sure if you're available and you're married. Now, let me ask you, what if you're not married? What if you are dating? Would this be something that, they could attend as well?
I think it's welcome to all couples. So these are couples that are seriously considering marriage. They want to know, well, how do I optimize this relationship and to have a successful marriage? And so I think that could be couples, it can be engaged couples, it can be married couples. You can find more information at kingdomdocs.com for this marriage workshop, November 9th from 10 a.m. to 2 p.m.
Awesome. All right, guys, if you're in the area, check it out.
Thank you.
Thank you for tuning in to WSAN Radio. Catch us on our YouTube channel, WSAN Radio SA. Subscribe to our channel and hit that notification button.